So with that being said, we have the honor of actually having two guests with us today. We have James Koch and Tila Nguyen. They both are management analysts within the Employee and Retirement Benefits Division. And James is going to be our presenter today. So I'm going to go ahead and turn that over to him.
Well, good morning, everybody. It's really my privilege to be here talking to you all. As we were waiting to start, I was kind of cruising the attendee list, and I was pleased to see so many people I've talked to over the last number of years. You know, we've been distributing data to school districts for the past 5 years, and we have, you know, some big changes this year with SEBB, and so I'm appreciative of the opportunity to talk to you all through this webinar. You know, my team is responsible for distributing SEBB and PEB enrollment data to the school districts. We also annually produce over 162,000 of our own Forms 1095C in our case, for about 150 Washington state agencies and higher education institutions. So I appreciate that this is something that most of you probably deal with once a year annually. This is a year-round kind of a thing for us based on the scope of you know, our project. And so I'm glad you could join me today, and let's jump right into it. You know, since 2016, you know, that was for 2015 Forms 1095, the Employee and Retirees Benefits Division, or ERB, has provided PEB enrollment data to school districts to support their Form 1095C and or Form 1095B reporting requirements. This Form 1095 data, this enrollment data, supports two different federal reporting requirements. I thought I'd nod to those. The first is employer shared responsibility reporting. This provides IRS data about offers of coverage to full-time employees, and that's full-time by the federal definition of full-time. It's using the 130-hour standard for those of you that work with this. And it's reported on a Form 1095C. Under IRS regulations, only large employers, those with 50 or more full-time employees, are required to file Form 1095C. The second requirement is called reporting of health insurance coverage. And this provides IRS data about enrollment in medical coverage. Employers are only directly responsible for this reporting requirement if their employees or former employees, like retirees, enroll in self-insured medical coverage. And it's reported on either a Form 1095C or a Form 1095B. Most employers who already issue a Form 1095C use that form for this reporting requirement. Employers who don't have to issue Form 1095C because they don't have 50 or more full-time employees use a Form 1095B. So under these reporting requirements, employees and former employees must receive a copy of the Form 1095C or 1095B provided to IRS. So you transmit data to IRS and you provide a copy to employees. Under those same IRS regulations, all employers who have employees or former employees enrolled in self-insured coverage must report that enrollment. And a small employer, one with less than 50 full-time employees, would report that on a 1095B. And so just to make sure we're all kind of clued into the forms that we use for those reporting, I'm just going to pull them up here. And I imagine for most of you, this is old news. But in any of your search, windows, I'm using Bing right now. Just if you search IRS forms, you'll get a link to Forms and Instructions Internal Revenue Service website. And if you click on that, you'll get a search box here. And I'm just going to type 1095 into that box, and I'll get related forms. And so you'll see a group of 7 forms come up. And these were recently updated. If you haven't tracked on this, just a few weeks ago, they updated the 2020 versions. But you'll get a link to the 1095C and the 1095B, and instructions for the 1095C and instructions for the 1095B. And you can use the same searching method to find the 1094 documents that you use to actually transmit this data. But the 1095C that we're talking about, it does look just a little bit different this year. Here's your 1095C. And for those of you that are familiar with this and haven't seen the new form, you're kind of wondering, hey, where did Part 3 go? Part 3 has been added to it's page 3 on here, but the second page of fillable information. So the document is now 4 pages, 2 different pages have instructions, and all enrollment is reported in Part 3. And if I go back, I'll just click on the 1095B for those small employers that are out. I know we have at least 1 or 2 that are signed on today. Here's the 1095B, and it's unchanged from the prior year. So it's 1 page and 1 page of instructions. And in the 1095B, it's this section here, Part 4, where you would report self-insured enrollment. So I want to just make sure it's in red here on the slide, but we're talking historically. And so this is for all past years. I just want to kind of review where we've been and compare it with where we are this coming year under SEBB. So historically, school districts have been in one of 2 categories for our Form 1095 enrollment data distribution. Districts that did participate in PEB for employees and districts that did not participate in PEB for employees. Districts that did participate in PEB for employees have received 2 types of data from us. The first type of data is employee and member medical enrollment data. And we provided data for both waived and enrolled status for enrollment in all plans, both self-insured, which are any uniform medical plan coverage plans, and fully insured plans, like Primera or Kaiser Permanente. The second type of data that we provided is retiree and member medical enrollment data. We provided data for retirees in enrolled status only, that's the only one that would be applicable, and also for self-pay COBRA or leave without pay enrolled status. For enrollment in only self-insured plans, again, this is any uniform medical plan coverage. That's for districts that did participate. For districts that did not historically participate in PEB for employees, they only received 1 type of data. They received only retiree and member medical enrollment data. And we provided data for retirees in enrolled status and also for self-pay COBRA or leave without pay enrolled status for enrollment in only self-insured plans, which again was any uniform medical plan coverage. The majority of districts were in this category. The minority participated with PEB for employee coverage. So beginning with the year we're in, beginning with 2020 enrollment, all districts participate in SEBB for employees, and all districts participate in PEB for retirees. This year, we will provide the same type of enrollment data to school districts. So if you previously did not participate in PEB for your employees, this year you will get additional enrollment data because now you do participate in SEBB for your employees. So those data files are going to be much bigger because instead of just providing retiree enrollment in uniform medical plan, we will provide enrollment of all employees in all plans and retirees enrolled in uniform medical plan. So here's a description of the data all SEBB organizations will receive this year for this year's 2020 enrollment data. All districts participate, all will receive employee and member medical enrollment data. We'll provide both waived and enrolled status, and also for self-pay COBRA or leave without pay enrolled status for enrollment in all plans, both self-insured, which are any uniform medical plan coverage and fully insured coverage. And all districts continue to participate in PEB, so all districts will continue to receive retiree and member medical enrollment data. We'll provide data for retirees in enrolled status, for enrollment in only self-insured plans, again, any UMP coverage. "2020 enrollment data files will be provided to all districts on the same schedule as past years. 2020 enrollment data will be distributed in early January of 2020. We're targeting the January 10th. January 10th is on a weekend, so it may be the first weekday following that date. 2020 enrollment data corrections will be distributed monthly thereafter. Now, most districts shouldn't receive data correction files. This chart shows our actual 2019 experience. In January, we distributed 301 school district data files. In February, only 26 districts received corrected files. In March, only 19, April 2, May 3, and it stays very low thereafter, if at all. These file totals directly relate to keying within the lower limit, our allowance that districts key within the lower limit. After that lower limit passes, we have, less retroactive corrections. A good example is to think of an employee who had a newborn in December. If they didn't report the newborn's enrollment to you until after January 10th, when we've distributed those files, and actually it would be really after January 1st when we grab the data from December to give you on the 10th of January. If they don't let you know that newborn, then it's not in our data. Once they report that newborn, let's say on January 15th, well, then we would give you that update in February. And then you would know that really in December, that individual had a newborn that none of us knew about when the data was shared. Now, we do expect the number of districts receiving corrected files to be a bit higher this year because of the increased number of employee records for SEBB enrollment. And one note, we do send enrollment data corrections for prior years as needed. For example, if we receive a dependent SSN correction, we'll send corrected data files for prior years. If in prior years we use that wrong SSN, we'll give you a correction that applies to all the data that we've provided. Last Friday, on the 13th, a dubious date. I was a little nervous sending these files on Friday the 13th, but last Friday, SEBB organizations were provided a data dictionary that defines all data fields provided in the full year and amended files, a sample full year text data file, a sample amended text data file, a guidance document for full year and amended data files, and a document that explains how to open a text data file in Microsoft Excel. This data was emailed to the individual we sent Form 1095 enrollment data to last year, or an updated contact provided by your SEBB organization specifically for 1095 data. We have about 15 SEBB organizations where the email bounced because our Form 1095 contact no longer works at the district. And we are reaching out to those districts now for a new contact. We're really careful with this data. We send it through a secure email distribution system, the State of Washington Secure Email Utility, and we only send it to the contact that we verified. And so before sending that actual district or SEBB organization enrollment data, we verify that distribution contact. So those will be coming actually in the next week or so. We may send some of those today, actually, even. So when you receive the email asking you to confirm your information, please respond as soon as you can. And when we correct for those undeliverables, we'll resend all the information that bounced, of course, when we have the new contact provided to us. Now, the text files that we send with data are virtually the same format as prior years. There are new carrier codes to represent the new SEBB medical plan codes. And like all data elements in the text file, the new carrier codes are defined in the data dictionary. SEBB and PEB data will be provided in the same data file. Historically, we've provided employee and retiree information in the same data file. So this will be familiar for districts that historically participated in PEB for employee coverage. For clarity and data sorting convenience, we've added a PEB-SEBB indicator to each record. Now, I know you can't read this blur of data down here, but you can see the expanded view where the PEB-SEBB indicator appears at the end of each record. We added it to the end so it doesn't change the data order compared to previous year's data. There's an exception to the rule that SEBB organizations will only receive one data file, so I'm going to cover that here. SEBB organizations that enroll PEB eligible individuals who are not eligible for SEBB will receive an additional file we're calling a 601 file. All SEBB organizations have an agency code that begins with 600. 601 simply refers to a second agency code we established for enrollment of two types of subscribers employed by SEBB organizations that aren't eligible for SEBB coverage. Most of you won't have people in this circumstance, but we do have quite a number that are. These two categories include non-represented employees of educational service districts and school board members of school districts. And so, as an example, Agency 600D00 will receive two files from us this year. They'll receive a first file that begins with where the agency code begins with 600, that includes employees in SEBB and retirees in PEB. And they'll receive a second file that begins with 601 that includes their non-represented employees who are enrolled in PEB. Similarly, in example 2, for example, Agency 600F07 will receive two files. Their 600 file will include employees enrolled in SEBB and retirees enrolled in PEB. And their 601 file will include school board members who are enrolled in PEB. The files are identical in structure, so a SEBB organization can combine the two files they receive, the 600 and the 601, if they choose to. Most school districts will receive significantly larger data files this year. This is a notable change from last year. They'll be larger, of course, due to the SEBB employee enrollment data. So districts should make sure that they're ready to handle that larger file. I think historically, many districts who only were, reporting the enrollment of their self-insured UMP retirees maybe handled that file differently than they did their employee data, just because of its size. But these files will be, very large, and districts should be ready to manage that large size. They may not be as easily handled on a manual basis. The second notable I wanted to cover, under federal regulations, large school districts, those are more than 50 full-time employees under the federal rules, must complete IRS Form 1095-C Part 3 for employees with enrollment in self-insured coverage. And for SEBB, this is any uniform medical plan coverage. Historically, most districts haven't offered self-insured coverage for their employees, so they haven't had to complete Part 3 of Form 1095-C for employees. they may have completed Part 3 if they chose to report those uniform medical plan and retirees on their 1095-C. But this year, they'll have to complete that section for employees who were enrolled in uniform medical plan coverage, just like they've had to report the enrollment of retirees enrolled in uniform medical plan coverage for the past 5 years. Bullet 3, non-full-time employees under the federal rules with self-insured enrollment, uniform medical plan coverage, must receive an IRS Form 1095. These employees may not have historically received a Form 1095-C because they were not full-time for a month and not enrolled in self-insured coverage. So let me give you an example of that. This is important. For example, if you consider a 20-hour per week employee, the employee would likely not be determined full-time under federal rules because that's a 30-hour standard per week, not a 20-hour standard. But they would likely be determined eligible under the SEBB 630-hour eligibility standard. If that employee elected to enroll in self-insured UMP coverage, they need to receive a Form 1095-C or B because their uniform medical plan self-insured enrollment requires them to receive a form. So districts that didn't have didn't have self-insured coverage for employees historically may have just that subset of employees would not have been form eligible because they were not full-time for at least 1 month in the report year. Now the standard should be if they're full-time for at least 1 month in the report year, or if they're enrolled in self-insured coverage for a month, then they need to receive a form. So that group of employees may not have been a form recipient, but they will need to be this year. Also notable this year, the due dates for IRS Form 1095-C and B were automatically extended to March 2nd of 2020. This is similar to prior year reporting deadline extensions. I would note that under that notice 2020-76, IRS indicated that they may not automatically extend the due date in the future. If that extension is important to your district or the districts you work with, you should provide IRS with feedback that the district, wants the automatic extensions to continue. I know for the state of Washington, we'll be sending that guidance or that feedback to IRS as well. Supporting the automatic extension is a good idea. You remember this chart I showed earlier, because we know the majority of corrections to prior year data occur during that automatic extension period. If IRS stops providing the automatic extension in the future, the regulations still provide an option to request a 30-day extension, which might be a good idea for your district because that would reduce the number of corrected forms 1095-C that you would need to produce for any changes that occurred after you reported in January. Something to consider.
Hey, James, we do have a quick question I wanted to address about the extension.
Sure.
So is that extension only for employee forms? It's not for the file to the IRS, correct?
That is correct.
Or is it? Okay, perfect. Just wanted to clarify that. Thank you.
Yeah, it's kind of funny because the regulations discuss, you have an obligation to transmit to IRS and to copy that information to the employee. But in practically, it's the reverse. The employee deadline occurs in January 31st of each year, unless extended, and then the transmission to IRS. For the vast majority of people I'm talking with right now, you electronically transmit that information to IRS because the number of transmissions you make each year require that. And so that's a March 31st deadline of each year. If you're doing these by paper because you're a smaller SEBB organization and you don't have to do it electronically, then that transmission date is earlier than March. It's the end of February. But neither of the transmission to IRS dates are changed. That extension, just like past years, just applies to the due date for the forms to employees and former employees.
Awesome, thank you.
Okay, so moving to the next. Also notable this year, the the 2020 Form 1095C, I showed you the box a little earlier, or the form a little earlier, and so you saw some of the big changes. The plan start month box is now mandatory, so that's been optional. Oh, I skipped a couple here. The 2 pages for all recipients, we talked through that. There's a new box that's the employee age on January 1st. That really just applies to individual coverage health reimbursement accounts, and it's not applicable for SEBB coverage. And so that age on January 1st is a box that, let me see if I can just pull this up real quick. Here it is. Oh, the B, we'll go back to the C. So here's the plan start month box, or sorry, the employee age. So the employee age on 21st, this is a new box. It's only relevant if you're offering individual coverage health reimbursement accounts. And that's not applicable for SEBB coverage. So for SEBB coverage, this can continue to not be completed, or cannot be completed, it's new form. The plan start month box here has been an optional box. So many of you may have already been providing it, but it is now mandatory. And so for SEBB coverage, the plan start month is 01, so it's just an 01 value that would go in that box. There are new line 14 codes. So the codes that go in line 14 have been extended, and they're described back here. They are 1L through 1S. And again, all of these codes relate to individual coverage health reimbursement accounts and arrangements, and they're not applicable for SEBB coverage. So these new codes are not applicable, but you will see them on the instruction. And similarly, let's go back to this. Similarly, the Form 1094C has a new code available, but it's directly related to individual coverage HRAs, and it's not applicable for SEBB coverage. Okay, so again, here's the list of documents that we sent to SEBB organizations last Friday. I'd like to provide a bit of an orientation to these files, and I'm really glad to have this opportunity because every year we distribute your actual data files. We get a lot of questions from personnel and payroll staff who I don't think had a chance to review the sample files before the real files got there, and the call kind of goes like, what is this? It's a ton of information. And so I want to kind of give you a quick run through of the files that we send, and so you have a bit of familiarity with them. So the first one I'd like to speak to is the data dictionary, and it really is the most important document. If you're familiar with this, all the other data will make a lot more sense to you. It defines the structure of the file and all of the fields that are found in the data file. As I mentioned before, get this out of the way, only this field 28 is new, and compared to last year's data format. It's the PEB-SEBB indicator. This data dictionary defines the naming convention, and so here it describes the name of the file that will be received and gives you a sample name. It's labeled by the agency and sub-agency codes, and it includes the year and the month the file was generated. So these last 2021-01, for instance, here are important because if you put all these files in a secure folder, it helps you keep them straight in terms of which files came first, and that's important. As you'll see in the sample file when I pull it up, it's a pipe delimited format, so we kind of describe that here. It just means there's a pipe character in between each field of data, what that does, it does a couple things. It separates your data. If you're ingesting that data into any database or opening it in Excel, it gives it a character by which to designate field delineations. So our data dictionary provides a field number, a field name, a description and data value, and the fixed width length of the data field. As a fixed width record, when a reported value is less characters than the maximum allowed, like for a name, the field value is padded with spaces to the full field length. So when you get these files, each record has the same number of characters in it with that padding. So let's just run through these real quickly. Field 1 is the subscriber's SSN. It's typically the SSN of the district's employee or the SEBB organization's employee or former employee. All members enrolled under the employee will have the same subscriber SSN. Field number 2 is the member SSN, and that's the SSN for each unique enrollee. Field 3 describes the coverage year and coverage month. In January of 2021, we will provide records for January of 2020 and for February of 2020 and for March of 2020. We'll provide records for each month of 2020. So that 4-month value will be here. Field number 4 is the agency sub-agency code. And really for SEBB organizations, you're kind of familiar with this just being referred to as an agency code. This will match the file name, and there'll only be one agency sub-agency code per file. Field 5 is the member type. The member type simply indicates whether the record is for an employee or a subscriber as the number 1, 2 spouse, 3 dependent. Fields 6 through 10 are member identifying information. This field 10, the member's birth date, that's an important record for purposes when an actual SSN is not available for that member. For example, if a proxy SSN is used to enroll a dependent before an SSN is available, for example, 999990001, then the employer should be using a birth date in lieu of an SSN that, because that SSN is known to be inaccurate. You haven't received it yet. So that birth date there would be important for that. Field 11 is an enrollment indicator. There's only 3. A value of Y means enrolled, D is waived, and N, you really won't get this in your file unless it's a corrected record. And so you're really only going to get Ys and Ds in your regular full year file. Any corrected files may include an N. Each of those, each Y and D reflect an offer of coverage when you're thinking about the value that you'll fill in your 1095C line 14. That asks you, was the employee offered coverage? If you know that they were enrolled or you know that they waived, well, then you know that they were offered coverage. Field 12 takes up several pages now in our document because these health carrier codes change a little bit by year. And so, because our data may give corrections for a prior year, then you might get codes from a prior year, depending on the data that we're providing to you. So you need to be careful to reference the appropriate year. Note here that we include an important note in all of these fields, and this is the 2020 health carrier codes. We arrange them by PEB coverage and SEBB coverage beginning in 2020. For prior years, you'll see that it's noting the year, and it's all just PEB coverage, so there's only one block for that. In each of these blocks, you'll note that the uniform plan carrier codes that begin with, in this year it's U or V, in prior years it's U only, are self-insured coverage. So any of your plans here that are, begin with a health carrier of U or a letter of V are self-insured coverage. Let's move to the next. So this is all prior year carrier codes. Line 13, eligibility type, gives you, defines whether or not it was employee, COBRA, leave without pay, or retiree coverage. Field 14 restates the information from field 11. It just gives a yes or no. It gives you a Y code if there was an offer of medical coverage. So it's a shortcut of the field 11 Y and D codes that I just described. Field 15 is the medical effective date based on the current eligibility type. So for most SEBB people, that date will be 2020-01-01 because January 1st was the first date of SEBB. If you had someone start midway through the year, it'll reflect that date. Fields 16 through 20 are just simply address values for the subscriber's address. Field 21 is called an originating SSN. And there are two scenarios that are important that are informed by this value. One, it's a surviving spouse that's enrolled in coverage. And two, it's a dependent that's enrolled in coverage. In both those cases, the subscriber's SSN is going to be a person who didn't used to be your employee. And so let's say you had an employee, they retired, and they're married. We would give you data for both of those people. When the employee is deceased, then we convert that coverage into the surviving spouse's SSN. And so you would get an SSN that if you looked at the subscriber SSN, you might not recognize that person in your payroll data as a former employee. The originating SSN should include the deceased employee's SSN, which you probably will find in your payroll data. Same story with a dependent enrolled in COBRA. You know, for a COBRA offer, the dependent has an independent election opportunity. And if an individual only chose to enroll a dependent in COBRA, that person gets set up with their own subscriber SSN. And so again, that originating SSN should show you the employee from which they got their COBRA eligibility, and that might make better sense as to why you have that person in your data. 22 is a Medicare indicator. It just means that the IRB division staff have verified the member's enrollment in Medicare A and B. We understand that some districts may not provide a Form 1095 to retirees who are enrolled in Medicare, but some do. Field 23 is a split account indicator. It simply indicates that when a subscriber is enrolled in Blue Cross Medicare Plan Supplement F or G, and one other family member is enrolled in Uniform Medical Plan. And so if the retiree who used to work at your district is enrolled in the Medicare plan, you don't need to report that information on a 1095. But if their spouse is not Medicare eligible, they default into the Uniform Medical Plan product. And so their enrollment would need to be reported on a 1095. In that case, you know, for the state, what we do is we issue the 1095 to the former employee, but we only include the enrollment for the Uniform Medical Plan enrollee in Part 3 of the 1095C. It will be the same logic for a 1095B. Field 24 is the in coverage year and month, and that date always agrees with the date from the file name. Field 25 is a country of residence. It was a value that was added to the address, and so it's out of order here, but that's all it is. Field 26 is just our internal Pay 1 system number. It really is not so relevant to you for the reporting purpose. The record status, there are two indicators, either an A or a D. All the records we provide in January will be an A record, and you would need to add those records to your file for reporting purposes. When we give corrected records, we may give you a delete record for a previous period. And so when you get that D record, you can remove an existing record from reporting purposes, or do nothing if no record exists. There are a couple scenarios where you may get a D record and you didn't previously receive that record. You can ignore that record in that case. And finally, the PEB-SEBB indicator, it really just gives you an easy way when you pull this information into Excel or something like that to delineate your data from PEB versus SEBB if you need to or choose to. Okay, the next file, this is the part I even remembered how to do it here. Okay, so the next data file that I want to bring up is the sample full year file. So this is one of the data files, that you got last week. It looks very similar to the kind of data that you'll receive when you get real data, but it's kind of a mess if you look at it. It's like, what is this data? It's very confusing. So I'm going to make it bigger just so we can all see it. But basically, it just, I wanted to just show you, when we talked about the data dictionary, we said, well, the first field is the subscriber SSN. So here's that field. And it's a pipe delimited file. And so you can see these are the pipes that delineate the two data fields. This is the member SSN. This data here, if you think about the 4 period that we talked about, you can see that we're providing a 2020 01, 2, 3, 4, all the way through 12. So for John Q. Public, we're providing you 12 different records. Each record refers to a unique calendar month of coverage. And so, your July file is in that. You can find that by the 4 data 2020 07. If we go across to here, you can see that the type of coverage is defined, whether it's employee coverage or retiree coverage. This is the enrollment indicator, which will be a Y or a D. This is the health carrier code. And you remember, if the first digit is a U or a V, it's self-insured coverage that needs to be reported on a 1095. The rest of the information is less important for reporting purposes. But again, you can track on all that. I mean, it is if you're using the addresses and such from this. But I'm not going to go any more in detail to this. I just want to show you that relationship. The next file is the sample amended file. It's going to be the same format as the full year file. These are all exactly the same format. And let's make it a little bigger so you can kind of see. In this case, you'll see that that we have provided both A and D records. So these are examples of records that would be deleted based on the type of change that's being made. These files will always be much, much smaller because they're only reporting data on records that are changed. And so the way to best understand these two files is to take a look at this document. That's our SEBB highlighted guidance document. And you'll recognize this data structure from the full year file that I just showed you. And you'll recognize these specific records from the amended data file. And so these are basically just putting the two together and describing how the interplay between them. And so this part here gives a good description of how the deleted files are used and how they interact with the annual file. I have to move a couple things here to grab my. So for example, the 99% of corrected records fall into one of these 4 categories: either adding a new record when none previously existed, or deleting a record that was previously provided but now has changed, or changing a record that was previously provided, like for a carrier code change, or correcting an SSN. And the way we've organized this information, let's say we're adding a new record when none previously existed. We're telling you with this amended record that there should be an enrollment for 2020-09, that's September of 2020. And you can see that it's an A record here, so we know that that needs to be added. And if we bear this 2020-09 file in regard to the original data that was provided, remember that was a green color, you can see that previously we said only they were enrolled in October, November, and December. The amended file adds a September record to that employee. So their 1095 that was produced originally only showing 3 months of enrollment is clarified with the amended record to be inaccurate. It should have included 4 months of enrollment. In the same way, when we have a delete record, you'll see that it comes across with a D code here in yellow. And we're telling you that the previous record from 2020-12 should be deleted. And so if we go up above and we find that 2020-12 record, That's the record that we know should be deleted. In John Q. Public's 1095, we may have reflected him enrolled as all 12 months, but now we know we'd have to correct that to show only enrollment for months 1 through 11. When we change a record, same story. It's a record that was previously provided, and we're going to get, when you compare the two records, you'll see that there's a new health plan here, KWS, that previously was reported as VA. So again, it's just a call to update that previously provided data record. And in the final example for Sheila Newby here, we know that her SSN as originally provided is now being updated from AAA 001 to AAA 5585. And you'll see that we're telling you to delete the original record that was provided and add the new record. When you get SSN changes, there will be way more records because we're deleting each, let's say we gave, a normal person, maybe they had 12 months of enrollment, we'll give you 12 deleted records and 12 new add records. So you get a total of 24 records for a simple SSN correction. Okay, and then I guess I wanted to show one more thing. The other thing that we get questions about are how do you actually open a file in Excel? And we do provide a document here that gives you a quick step-by-step process on how to open that file in Excel. It literally will only take you about 30 seconds to do so. If you follow this, you'll easily be able to open that in Excel and be able to look at that in a format that most people are familiar with. And so if you have trouble with that, you're welcome to give us a call. We can help problem solve that. But this really does work for 99% of the people. So I wanted to call out that that's in there. With that, I think that was the end of it. So we do have some time available for questions. If you have any, I'm happy to provide the answers.
So James, there were quite a few questions in regards to what people need to report under Part 3 of the 1095. So could you clarify that, please?
Yeah, so in the data file, we're going to provide for employees all of your enrollment. And that's because line 14 asks you for offer of coverage information, and your enrollment will help, describe whether or not they were offered coverage, regardless of the plan they actually elected to enroll in. And so, as I say, if we've provided a yes that they were enrolled or a D that they waived enrollment, both of those are offered, indicate that coverage was offered. And our coverage is meets the requirements of the Affordable Care Act. It's good coverage and it's affordable coverage for employees. And so, that's why we provide all that data. However, only that enrollment in self-insured coverage must be reported in Part 3. So if half of your employees selected Kaiser plans and half selected uniform medical plans, only those that elected uniform medical plans will have enrollment defined in Part 3 of the 1095C. The folks who enrolled in the fully insured plans, in the Primera or Kaiser plans, they'll receive a 1095B directly from those fully insured plans. And so they'll get two documents rather than just the 1095C from you as an employer. I guess the other piece that I would want to say is, when we include retirees in your data file, we only include retirees who elected uniform medical plan, because you don't really have a need for that data for this purpose otherwise. So all of the retiree data that we provide, where they are enrolled in uniform medical plan, they also need to receive a 1095 from your district. Now, we're not here to provide tax consultation or attorney advice. And there are a lot of different options for reporting available to SEBB organizations and large employers and small employers. And so, you know, some districts and SEBB organizations will choose to report their retirees on a 1095-C using a specific code set in line 14, 15, and 16 that's defined in the instructions, and then include their uniform medical plan in part 3 of that form. Other districts and SEBB organizations may choose to report those retirees using a 1095-B form. Either is allowable, and it just comes down to how your district has decided to do that reporting. But the rule is that in either of those forms, the only people you're reporting the enrollment of in part 3 or part 4 of the 1095-B is those enrolled in self-insured coverage, which is uniform medical plan coverage, which are the health carrier codes that start with either a U or a V.
So James, we have another question in regards to VEBA. It says one of them is, are the HRA coverage codes required if a district participate in VEBA?
I wouldn't be able to answer that question for you.
And then another questions we also have is a lot of districts are offering VEBA accounts that would be considered a HRA, correct? So we would need an employee's age and the information for box 14 for any employees who receive an employer contribution to VEBA.
Yeah, I mean, this training only covers the information that we're providing for SEBB enrollment and PEB enrollment. And so the VEBA questions, I'm not able to speak to in this training. That's not coverage provided by you know, PEB or SEBB.
There was a question in regards to contacts. If there are changes in their contacts, we would just want, if you have a new contact for the ACA 1095, please just send us an email to the HCA PEB enrollment data at hca.wa.gov. So that was the other question that we received.
Yeah, the best way to update that data is to respond to the documents that we've sent you where you've previously confirmed that information. But we'll take it any way you can get it. We can get it. You can, and in every piece of information we send, we give the contact information for both Tila and myself, and a general HCA PEB enrollment website. And so in the follow-up information that we send back on questions and answers, we can include that information. But any documentation that you've received from us previously will have that information on it. It seems like a really obvious thing we should have put on a slide here, but I don't have that right now.
All right, so it looks like it's 10:59, so we went right up to 11 o'clock. So any questions that were not addressed during today's webinar, James said give them about 2 weeks or so to follow up. They'll follow up by either phone, email, or Fuse.
I'm sorry.
Oh, go ahead.
I'm sorry. There was a last question that just came up that is asking us to go back a slide to the help info slide.
I'm not sure which slide you're talking about. Was it a slide or was it the if whoever has that question, if you could just send in a little bit more detail for us, and we'll follow up with you specifically.
Oh, she said it was it's slide 19 or 18.
Okay, so this is 18.
Looks like it was 19.
19 is just a list of the files. Yeah, if you, I'm happy to follow up. We'll just follow up specifically with you.
All right, perfect. So if you want to go to the second to last slide. So of course, this webinar was recorded and it will be posted probably early next week for those of you who want to review it. And the presentation is also posted now currently on the BA website. We don't have any upcoming webinars currently, but check the registration page on the BA website frequently because we will post when we get ready to do another webinar. We'll post that for you all to register. I want to thank everyone for participating and also thank you to James and Tila for presenting this awesome info. I'm sure it helped a lot of people. I know it helped me understand all of these codes and everything a little bit better. So thank you everyone for participating and I hope you all have a great weekend and a great rest of your Friday.